Hello, I'm Dr. Flavia Bustreo. I'm the chair of the governance of the Partnership for Maternal, Newborn and Child Health and the vice chair of the Fondation Botnar. It's really exciting today to be with you on the anniversary of the Paris Agreement on climate change, on invitation of Domenico Vito in this virtual agora. And I'm especially delighted to have this conversation with one of the young activists of the Partnership for Maternal, Newborn and Child Health, Giulia Gasparri.
Thank you, Dr. Bustreo, for being here with us today. It's great to have a conversation with you, given your former work at the WHO as Assistant Director General for Families, Women and Children's Health, and for all your work concerning the social and environmental determinants of health. Dr. Bustreo has participated to many COPs and to the Paris Agreement, where she was one of the main forces pushing for the right to health. So the first question which we have for you today is to get a better understanding of what are the connections between the climate crisis and the health crisis. So what effect does the climate emergency have on human health and the planet?
Thank you very much for that question, Giulia. I think the simplest way to understand this is to look at the health of the planet and the health of the people as two sides of the same coin. They are so inextricably linked that whatever affects one side affects also the other sides. So, for example, the changes in climate that we have seen and documented over the last decades have affected the distribution, the epidemiology and the biology of the diseases that affect people and human beings. For example, what we are seeing now, because of climate change and because of the temperature warming, that we see malaria and the vector, the mosquito for malaria, we see that altitude, higher altitude than we were seeing them 20 years ago in the altiplane of Kenya and Ethiopia. So we see change in the transmission of diseases that affect human beings, but also another modality through which climate change affects health of the people is through the impact on the food production. And as you know very well, the climate change has meant desertification, especially in sub-Saharan Africa, in the desertic part, has meant significant water scarcity, especially in those countries, and this has impacted food production and has a direct impact in the nutrition of people and in the malnutrition, especially of children under 5 years of age. And we should not forget that malnutrition is actually underlying 50% of the deaths in children under 5. Another modality, Giulia, that is very important to recall in this conversation is climate change is changing also the quality of the air we breathe. And air pollution is the key environmental factor for health. WHO estimates that every year around 7 million deaths are attributed to indoor air pollutions. And as you know from your work, the production and the consumption of fossil fuels means that the air we breathe is rich with particulate matters that is particularly damaging for our own health. So in sum, when we look at these two sides of the coins, we understand very well that climate change is also, like it's been written several times in the Lancet Countdown, is also the main health emergency of this century and is a huge challenge that the world has to face.
Thank you, Flavia, for this thorough explanation. So given what you just mentioned, are the health risks of climate change impacting all human beings in the same way, or are there social inequalities?
Simple answer is no. The impact of climate change is not affecting every individual in the planet in the same way. And it's in fact affecting the most the poorest and the poorest countries in the world. Because, for example, if we look at the impact of desertification, as I mentioned, it is explicit and affecting particularly the poorest countries of the sub-Saharan African belt. Then if we look, for example, at the impact of air pollution and particularly indoor air pollution, we see that this is affecting in disproportionate manner women, especially women from low socioeconomic quintiles, because they use, during the cooking practices, they use very traditional stoves that are very polluting, that are using fossil fuels. So this climate change affects women in different manners, and also the poorest among the women, and also poor girls that are very often used and asked to do these tasks. And then finally, when we look at the distribution across different type of population, one thing I really like to mention is climate change affecting in a disproportionate manner people that are on the move, like the significant weather events that the world has registered in the last decades have meant that many people had to move from their own living quarters and have become what we define now climate refugees. They had to move because of floods, they had to move because of typhoon. And this is important to mention, because once you become displaced and you are on the move, the access to healthcare and healthcare services is far more challenging. So this is another population group that is significantly affected by the climate change. And that is why, Giulia, I think is entirely appropriate that we talk about climate change and we use the word climate justice, because when we look at the impact of climate change, this is not universally distributed, but is affected, in particular, some populations that are already affected by poor socioeconomic condition.
So we are now 5 years after the Paris Agreement. Are we seeing any progress in the understanding between the linkages between climate change and human health?
You're right. The Paris Agreement was a landmark agreement, and from our work, we were especially delighted to see that in the legal agreement the country subscribed, there was the inclusion and the recognition of these interlinkages that we have discussed. And this is specifically mentioned in the legal agreement, in the recognition of the right to health of people and how climate change affects that right. I should also add that this is the only human right that is specifically mentioned in the Paris Agreement. So for us, this was a great recognition and a great understanding that was unfolding. What is disappointing, Giulia, and this is where I think it's very important that people continue to discuss these issues and be active, is that the implementation of the Paris Agreement has been very, very low. Many countries have actually not kept to the promises they made. Some countries, like the United States government, actually withdrew from the Paris Agreement. So we haven't seen the progress that is required in the reduction of the production of and use of fossil fuels. We haven't seen the commitments translate into the adaptation plans and the mitigation plans that countries have committed. And therefore, it's urgent that 5 years after that we continued mobilization. And I'm really delighted to see that especially young people are really understanding this and moving along.
So in light of the discussion which we've had so far, why do you think there is a need for a more holistic One Health approach? So how can this One Health approach be useful to move the topic of climate justice and to open our eyes to a vision of a more planetary health?
This is important. We have begun our conversation. We discussed about the inextricable link between the health of the people and the health of the planet. And within the health of the planet, we also need to look clearly at the animals that live within the planet together with the human beings. And the concept of One Health approach, this is what has emerged in the last decade as a clear understanding. Because For example, if we look, Giulia, at the recent epidemic and pandemic that the world has witnessed and that have affected human beings in a very dramatic way, they have been linked to transmission from animals to human. For example, if we think about the swine flu that has affected 10 years ago, if we think about the transmission of we have currently in the COVID-19 pandemic, where we are investigating how the transmission came of the COVID-19 virus from the wet market of China. So this situation and health of the animals is so closely linked to the health of the people, and this is what is included into the concept of One Health approach. And when we talk about planetary health, we really look at the inclusion of all these concepts together, where we look at how healthy is our planet, how healthy is our forest, how healthy is our water supply, how healthy are the animals in the system, and how healthy are the people. So this is the concept that we have developed on planetary health, and we even one big medical journal like The Lancet has really developed a full stream of science and knowledge that is being discussed on planetary health.
So given your expertise, what advice would you give on how we can move this One Health approach forward?
I think one important aspect that I see is that we really need to approach planetary health and the discussion around this, including a human rights-based approach. Because when we use the human rights framework, then we talk about accountability of the rights that individuals have and the accountability that the state has towards the provision of those rights to individuals. So that is a critical aspect that we were able to enshrine in the Paris Agreement, but we need to continue to have very clear in the implementation. And also, if we use the human rights-based approach, Giulia, we have this understanding of the principles that accompany human rights-based approaches. And this includes, for example, very clear participation. Participation has been a huge pivotal aspect of implementation of human rights-based approach. And it's very evident, for example, in the sphere of climate change, that youth participation is transformative. What has happened in the last 2-3 years with Greta Thunberg and the Friday for Future movement and the participation of young people into the shaping of the policies around climate change, this is a exemplification in my mind of how important it is to use a human rights-based approach. So we have participation as a principle, we have accountability, so you can demand that rights to be fulfilled. And just yesterday, we had this incredible decision in the United Kingdom about the court recognizing that the death of a young adolescent was due to air pollution. So this is the transformative development, because so far states have not been really challenged in as far as they are not providing the right to health to their citizens in addressing the impact of climate change and the impact of air pollution. So in synthesis, addressing the challenge with a human rights approach and principles, I think is really the transformative part that we can see, and that will be unlocking really the potential for the future.
Thank you, Dr. Bustreo, for this insightful conversation. We have just one last question for you today. So in light of the COVID-19 pandemic, is there anything we can take away from this experience?
Yes, the COVID-19 pandemic has devastated the world, and for the first time since the world influenza pandemic after the First World War, we have seen the entire world really affected, and we've never seen a situation like this where every single country is being touched by this pandemic. But there is one thing that makes me very optimistic, and one lesson that I think we can share. We have seen in the space of 9 months the production and development of a vaccine against an infectious diseases like coronavirus, which has moved from the benches of the lab to actually already the injection into the arms in the UK, in Canada, and already in the United States, and possibly shortly also in the rest of Europe and the other parts of the world. So this has been completely unprecedented, Giulia. We have never seen such a short time for the production and development and the research that is needed for a vaccine. And this has been possible because there has been an incredible investment in research, and also there has been a political will to move this in such a fast way to really combat the pandemic. So if there is one thing that we should learn in 2020 is that when the world is confronted by challenges, we can react, and we can react very fast, and we can mobilize. And I'm really appealing to the policymakers and the young people that participate in the debate that climate change is that kind of existential threat, far more than the pandemic that we are already seeing at the end, the light of the tunnel. So we need to apply the same kind of energy, the same kind of investment, the same kind of participatory modality to combat climate change. And I really hope that after the pandemic is under control, we can look at building back better and building back an economy that is far more friendly to the environment, that is looking at rebuilding the jobs that were lost during the socioeconomic crisis linked to COVID-19 pandemic. I sincerely hope those jobs will be rebuilt and they will be green jobs, because we do have new technology. I sincerely hope that we can invest significantly in innovation to combat climate change in a way that we haven't seen so far. So the word of optimism is, yes, if the world comes together, we can confront challenges, and we can confront the challenge of climate change and climate injustice.
Thank you, Dr. Bustreo, for this insightful conversation. And we wish the Climate Social Forum a lovely conversation later. Thank you.
Thank you. Thank you so much. And thanks, Domenico, for inviting us to be part from the Partnership for Maternal, Newborn and Child Health. We really like to collaborate with you and take any opportunity we can to add our voice to the debate. Thank you.